Hi everyone, it's Caroline bringing you guys this week's patient update. Things are still really slow in the clinic. We have one new patient that we'll talk about in just a minute and a few other fun facts, so let's go ahead and get into it. First up for this week, we have Golden Eagle 2516 from Kemmerer, Wyoming. This bird was found along a highway feeding on a deer carcass. Luckily, it was picked up by some good Samaritans and brought to our clinic. Upon admission, we found some really severe soft tissue damage on the shoulder and chest region of this bird, most likely secondary to being hit by a car. Thankfully, there are no orthopedic abnormalities. So last night, we actually went in and surgically repaired these soft tissue wounds. We cleaned them and sutured them shut. We also tested this bird for lead, and typically speaking, eagles do usually present with a lead level. This bird has a lead level of 27.1 micrograms per deciliter, which we would treat if this bird was showing clinical signs. This bird also was probably hit by a car, so we're having some trouble distinguishing between what could be head trauma or symptoms related to blood loss or lead toxicosis. So what we're going to do is retest this bird's lead level in about 5 days, and if treatment is still indicated, then we will use a chelating agent to get rid of the heavy metal toxicity. In the meantime, this bird is recovering in our oxygen unit, and he's got a long road ahead of him, but he did really well in surgery last night. Next up for this week, we have Swainson's Hawk 72724 from Afton, Wyoming. A few months back, this bird went through a surgical procedure called a femoral head ostectomy, or an FHO. The process of this procedure involves removing the head and neck of the femur and allowing the body's muscles, ligaments, and tendons to compensate for that loss. This surgery is very common amongst dogs and cats, and this is the first time at TRC that we have ever performed this procedure on a raptor. Something that we've noticed over the last few weeks is that this bird is favoring his right side, bearing most of his weight on that leg and foot. As a result, we have seen an infection called pododermatitis, or more commonly known as bumblefoot, developing. This infection thankfully is treatable if caught early enough, and we've been getting this bird in hand every few days to monitor the wounds on his feet and toes, cleaning and covering them. We've also been performing physical therapy on this bird to ensure that the joints and muscles are staying loose in that leg. And last for this week, we have Turkey Vulture 102524 from Rock Springs, Wyoming. This bird presented to us also with lead toxicosis that we were able to treat, and it did fully resolve. The issue with this bird is that since turkey vultures aren't in Wyoming in the winter, we haven't been able to actually get this bird back out to the wild. We've been trying to get this bird down to Texas, and our plans keep falling through due to weather or other inconveniences. So we're going to try our best to get this bird down to Texas as soon as possible. If for some reason we can't get him down there, then we will wait until other populations of turkey vultures come back to Wyoming when things start to warm up, and we'll release him here. Thank you guys so much for tuning in this week. Remember, if you want to do your part by keeping wild birds wild, click the link in the bio to donate or visit our website directly. Thank you.